Hi, my name is Thomas Barnett. And if you're anything like me, you've worked somewhere or been somewhere where the need for an AED has come up, and it may or may not have been there. Using an AED is simple, and knowing how to could save a life. Thankfully, I have not had to use an AED, but I have been trained in how to use one. The first thing you need to know about using an AED is knowing the signs of a heart attack. Oftentimes there's tightness in the chest, shortness of breath, pain down one side of the body, or just the person is completely unresponsive, like Bob here. Bob, he is unconscious right now. So the best way to tell is if he's having a heart attack is look for chest rise, or feel for the pulse here in his neck, or if Bob had arms, you'd feel his wrist pulse. Obviously, Bob is having a heart attack. So the first thing we need to do is call 911, no matter what. Whether there's an AED or not, we need to call 911. Second, if there is an AED, we need to go get it, or ask where one is and find it. Once we find the AED, we need to open it up. Check to make sure it's functioning. There will be a light that comes on. It'll say rescue ready or ready, depending on the model or brand. Then you will take out the AED pads. Some models they'll talk you through it, and other models they won't. Depending on what model you'll have to follow the steps in order for it to work correctly. But first thing you need to do is, if the person is wearing a shirt, you'll have to cut the shirt off. And watch out for women who wear bras with underwires. You'll have to remove those too, because the AED will cause an arc and severely burn the chest. Next thing you want to do is, if the chest is hairy, you want to remove that hair. In a lot of kits, AED kits, there's a razor. And if there isn't a razor, a lot of times they'll have spare AED pads. And that adhesive on the back is strong enough to remove the hair from the chest. And the next step will be to tear open the package and remove the AED electrodes. A lot of times they'll look exactly like this. If not, there will be slight variations and nothing serious that you'll have to be concerned about. There's a bumper between the two pads. It just keeps them from sticking to each other. And like I said earlier, if this is a verbal communication device, it will talk you through this step right here, and it'll tell you to remove one pad and stick it to the chest, and then the other pad and stick it to the other side of the chest. It will take just one pad, it doesn't matter which one, and we'll stick it right here, just to the right of center. And the other pad we'll take and we'll stick it just below the chest on the left side of the body. Just like that. First thing we need to do is we need to make sure these pads are plugged in. It will not work without it, and oftentimes if it is an instruction device, it will tell you that the device is not plugged in or not ready to go. Once this is all plugged in, the device will have another light that will say device ready. And most devices, especially nowadays, they measure for pulse in the chest. And the only time an AED will apply shock is if the heart is in V-fib. If there is no pulse or there is a good pulse, it will not shock or allow you to shock. The only reason you need to use an AED is to restart the heart because it's not beating properly. And once that occurs and there's a light on here that says shock, it will light up. You'll push that button and it'll apply a shock. If the heart is still in V-fib, it will ask you to apply another shock. Once the heart is either stopped beating or has started properly beating, it will tell you to remove the pads and wait for first responders to arrive. Using an AED is simple, like I said earlier, and knowing how to use one can save a life, possibly even one of your loved ones or one of yours. Knowing these steps can save a life and allow a victim enough time in order for first responders to arrive. An AED is a tool not unlike any other tool you would find around the house, except this one has the potential to save lives. I hope that everyone here today came away with the knowledge of knowing how to use an AED.